Welcome back to our Parent Caregiver webinar series, Before It Becomes More. I'm Corey Hammond from Partnership to End Addiction. Today's topic is mental health, stress, and substance use in youth. Here's what we will cover. First, we're going to talk about substance use in adolescence, mental health in adolescence, and then the main part of this video is what it looks like when those two issues combine. So when someone is struggling with both their substance use and their mental health. We will discuss how common it is for these issues to co-occur, what factors might put someone at risk, and what the current treatment landscape looks like. We will also discuss what parents and caregivers can do to help young people who might be at risk for this combination of issues. So first, let's discuss substance use in adolescence. To start us out, it can be helpful to look at just how many teens are using substances. So here we can see data from the Monitoring the Future survey, which is a nationwide survey of 8th, 10th, and 12th graders that started back in 1975. So the blue bars are the percentage of 8th graders, orange bars are the 10th graders, and purple bars are 12th graders. And this is looking at some of the most popular substances used among adolescents. So in 2025, we can see 41% of 12th graders, almost 24% of 10th graders, and 11% of 8th graders said that they had drank alcohol in the past year. 23% of high school seniors said that they've been drunk in the past year, and 29% have drank a flavored alcoholic beverage. When it comes to nicotine, 20% of seniors vaped nicotine in the past year. For marijuana, just over a quarter of high school seniors have used marijuana in the past year, and 16% have vaped marijuana in the past year. And so remember, as we're talking about substance use throughout this video, most teenagers are not using substances. None of these numbers are above 50%. But for those who are using substances, some of them will develop a substance use disorder, otherwise known as addiction. On this slide is the criteria for a substance use disorder. Symptoms include things like having difficulty cutting back their use, having intense cravings, having problems with relationships or work or school due to their use, and having withdrawal symptoms when trying to cut back or quit using a specific substance. So 2 or 3 of these symptoms is considered a mild substance use disorder, 4 to 5 is moderate, and 6 or more is severe. Among teens aged 12 to 17, slightly less than 8% met criteria for a substance use disorder. But for those who meet criteria for addiction, only 30% received treatment. So there's a definite treatment gap for teenagers. Many of those who need help aren't getting it. We're concerned about substance use in adolescence because the younger you are when you first try addictive substances like nicotine or alcohol, the higher your risk for developing addiction as an adult. Because the brain is still under construction during adolescence, it's especially susceptible to damage from those substances. These charts help to illustrate how important age of onset, or age of first use of substances, is when it comes to later risk of addiction. National data show that individuals who first use substances before the age of 18 have roughly a 1 in 4 chance of going on to develop addiction. For those who wait until after 21 or later, those odds drop to 1 in 25. So delaying use by just a few years can have a massive impact on someone's risk for addiction. But again, we want to remind parents that not using is the norm among young people. In 2025, 73% of 8th graders, 61% of 10th graders, and 41% of 12th graders were lifetime abstainers, meaning that they haven't used any substances, including nicotine, marijuana, and alcohol. Back in 1975, more than 95% of high school seniors had tried drugs before. Only 5% were not using. And then the numbers of those not using started to creep up. Only 40% of seniors now say that they've never used substances. And almost 70% haven't used anything in the past month. We've made great progress in this. So now that we've touched on substance use, let's look at mental health and stress in young people today. Many teens are stressed today. I'm sure that comes as no surprise to you. According to the American Psychological Association, in 2024, 70% of US teens identified anxiety or depression as major issues among their peers. 75% of high school students report experiencing boredom, anger, sadness, fear, or stress in school. On a 10-point scale where adults' stress averaged about a 3.8, American teens rate their stress at 5.8. So teens are more stressed than adults. 75% of high school students and 50% of middle schoolers consistently feel stressed due to schoolwork. Besides schoolwork, there's many other sources of stress for teens. Those on the left in orange are typical stressors. So things like social media, body dysmorphia, family relationships, and financial instability. The list on the right are stressors that could contribute to toxic stress. These may be more serious stressors with more negative consequences. So things like being a victim of bullying, domestic violence, or addiction at home, being a witness to a violent crime or some other traumatic event. It's important that we're aware of stress that's going on in a young person's life because stress can directly impact mental health. Stress can impact the risk for social isolation and loneliness, depression, anxiety, PTSD, personality disorders, and substance use disorders. For young people and adults dealing with high levels of stress, using substances is a common coping mechanism. Stress-related motivations were the most popular when teens asked why they're using substances. Almost 3/4 of teens who use substances say that they use to feel calm, mellow, or relaxed. And 44% said they use to stop worrying about a problem or to try to forget bad memories. So stress can cause substance use, but it also works the other way too. Young people with family histories of addiction report higher levels of stress than their peers without substance use in the family. So stress certainly plays a part, but also just broadly, teens are facing mental health struggles. The National Alliance on Mental Illness in 2022 found that 64% of teens feel the world is more stressful now than when their parents were their age. And about 1 in 6 report experiencing specific negative emotions all the time or often, and 1 in 4 have been diagnosed with a mental health condition. 50% of all mental health problems surface by age 14, and 75% of them surface by age 24. So if someone's going to struggle with a mental health disorder in life, chances are we're going to see that start when they are a teenager. Here are some measures of mental health among high school students and how they changed from 2021 to 2023. So starting from the bottom, in 2023, 40% of high school students said that they had experienced persistent feelings of sadness or hopelessness in the past 30 days. 29% said that they have experienced poor mental health in the past 30 days. 20% have seriously considered suicide, and 9% have attempted suicide. Most of these numbers are slightly better than in 2021, as you'll see with the different colors here, but not by much. This takes one of those measures, so high school students who report experiencing poor mental health, and breaks it down by different characteristics. Girls were more likely than boys to report poor mental health. American Indian or Alaskan Native students were the most likely to report poor mental health, followed by white and multiracial students. Finally, LGBTQ+ students were much more likely to report poor mental health than their cisgender heterosexual peers. So not all students are at equal risk when it comes to mental health issues. So we've discussed the current state of both mental health and substance use issues for young people today. Now let's talk about when someone has issues with both their mental health and substance use at the same time, otherwise known as a co-occurring disorder. So a co-occurring disorder, often abbreviated as COD, is the presence of one or more mental health disorders and a substance use disorder. They're diagnosed using criteria in the DSM, which is the diagnostic manual used by medical professionals. Co-occurring disorders are common, and they affect people across all demographic groups. So mental health and substance use have what's called a bidirectional relationship, which means that they both influence each other. Having a mental health issue puts someone at higher risk for substances, and vice versa. So using substances puts someone at higher risk for developing a mental health disorder. If someone is struggling with negative emotions or wanting to ease the symptoms of a mental health disorder, it makes sense that they may turn to substances like alcohol, marijuana, or tobacco to try to feel better. Unfortunately, as we'll talk about more in a moment, this has the potential to worsen their mental health. You may be wondering why we're making it a point to talk about co-occurring disorders specifically. That's because compared to people who have just a mental health disorder or just a substance use disorder, those who have both at the same time have more profound impairment, worse treatment outcomes, higher morbidity and mortality, so more illness and death. It's also more expensive to treat co-occurring disorders. And people who are struggling with both have a higher risk for homelessness, incarceration, and suicide. So the harms and the risks are amplified when both of these conditions are happening at the same time. As of 2024, about 21 million adults in the US had a co-occurring disorder. That includes almost 5 million young adults aged 18 to 25, which is about 13% of that population. Over 3% of teens aged 12 to 17 had co-occurrence of a major depressive episode and a substance use disorder in 2024. For over 600,000 teens, that included severe impairment due to their depression and their substance use. So this is an issue that affects a large amount of teens across the country. And unfortunately, because of that treatment gap, 30% of teens with co-occurring disorders received no treatment for either their substance use or their mental health. Only about 18% received treatment for both the substance use and the mental health issue. And so I keep mentioning mental health disorders broadly, but specifically what mental health issues commonly co-occur with substance use. This list here shows the most common. It includes major depression, anxiety disorders, ADHD, so attention deficit hyperactivity disorder, eating disorders like anorexia and bulimia, PTSD, bipolar disorder, and schizophrenia. And here's some data to back this up. The red bars are teens who had a major depression episode in the past year, and the yellow bars are teens without a major depressive episode. And we're comparing rates of substance use. For instance, 33% of teens with depression used illicit drugs in the past year, compared to only 12% of teens without depression. A similar relationship we can see with the rest: marijuana use, opioid use, binge drinking, and nicotine use. All much more common in teens who are also dealing with depression. In all, teens with depression had 3 times higher rates of substance use disorders compared to teens without depression. So what are the factors that might make someone more or less likely to develop a co-occurring disorder? First, let's go through the different pathways through which a co-occurring disorder might develop. So first, a person has an existing or emerging mental health challenge and is turning to substances to self-medicate or to feel better. Second is that a person has kind of equal predisposition to both mental health and substance use disorders. It's not always clear and doesn't always matter which one comes first. And third is someone has a change in their mental health status due to substance use. So this could be like someone's given pain medications after surgery that then leads to an addiction and then triggers a mental health disorder because of that addiction. And so here are some risk factors for co-occurring disorders. These are factors that put an individual at higher risk for mental health issues or substance use issues, and the combination of the two. So this includes factors such as inherent differences in brain structures. So our natural anatomy and personality might make us prone to mental health issues or more likely to engage in risky behavior like substances. Family history and genetics play a role in both mental health risk and substance use risk. Also, things like abuse, trauma, bullying, having a strained parent-child relationship, significant life changes, not feeling connected to friends or family, feeling unsafe at home or school, dealing with chronic illness or pain. Also, of course, using substances puts someone at higher risk for addiction and subsequent mental health issues. But on the other side of that coin, we have protective factors. So factors that make it less likely someone will develop a mental health issue or a substance use issue. And you'll notice many of these are just the opposite of the factors on the last slide. So having the support of parents or loved ones, feeling safe at home, in school, or in the community, feeling connected to school and friends, healthy habits, social activities that don't revolve around substance use, good problem solving and coping skills, resilience and spirituality. And finally, a really important protective factor that we discuss often throughout this series is having a bond with at least one trusted adult. Sometimes that's a parent or caregiver, but it could also be an older sibling, an uncle, a teacher, a coach, or another adult. So for individuals dealing with stress, mental health, and substance use issues, what does the current treatment landscape look like? Ideally, we want to catch the signs early, before someone ever develops a co-occurring disorder. So the time between the first symptoms of the mental health disorder and the eventual substance use disorder that develops is what we call the window of opportunity. 90% of people with a co-occurring disorder had a mental health disorder first. So for many people, it starts in early adolescence. Around age 11 is when their mental health disorder starts. And then the substance use disorder emerges 5 to 10 years later, around age 21 for most. So there's a span of several years there for most people where it's vital to intervene to try to prevent a co-occurring disorder. But again, once someone has both at the same time, it becomes much more complex and difficult to treat. So early intervention is key. But what might be someone's reasons for not getting treatment in that key window of opportunity? There's many reasons. One study surveyed adolescents and asked them why they didn't get the treatment that they needed. Some of their reasons are displayed here. So some teens thought that they would be able to handle their problems on their own. Some were worried about what others would think or say. Some were worried that their information wouldn't be kept private. And others believed that their family, friends, or religious group wouldn't approve of them getting treatment for their mental health. Others had issues with accessing treatment, so either they didn't know how or where to go for treatment, didn't think they'd be able to afford it, they had difficulties getting an appointment, or didn't have a way to get to their appointment. And finally, some teens thought that they weren't ready for treatment or believed that treatment wouldn't be able to help them. So in general, we understand that there's many barriers to getting adequate, affordable, evidence-based treatment for mental health and substance use. Many families report not being able to find therapists or clinicians in their area that are qualified to treat adolescents. Some families say that their child doesn't want to go to treatment, or they still feel stigma around seeking out mental health treatment. Others mention difficulties with insurance or scheduling around school hours. Many places have wait lists, so families can't always get treatment immediately. And finally, many adolescent treatment programs don't offer evidence-based care, which should include family involvement and wraparound services. So even if caregivers see the signs during that window of opportunity, it's still difficult to get that needed care. So what can parents and caregivers do to try to prevent and treat co-occurring disorders? Early prevention involves practices to try to reduce stress in the household. So these include establishing predictable routines and schedules to create a feeling of stability at home. Caregivers can teach and encourage healthy habits through positive reinforcement. Caregivers can model good coping skills. helping to teach children how they can manage stressful situations and bounce back. And finally, caregivers should try to prevent those adverse childhood experiences as much as possible by creating safe, stable, and nurturing relationships and environments. Adults can't always prevent those bad experiences, though, so we also want to promote as many positive childhood experiences as well. If you start to notice that a young person may be struggling with their mental health, start a conversation. You can express concern without being judgmental. You could say, "I've noticed that you're struggling and I really care about you." Or, "I want to make sure you know that you're not alone. I want to help you however I can." Be patient and listen, and leave that door open for more conversations in the future. Change and progress take time. Keep learning about prevention and support strategies. You can encourage healthy coping mechanisms, including things like exercise, therapy, and peer support. We want to reduce stigma as much as possible. Many young people don't reach out for help because they fear judgment and shame from those around them. And stay connected. Isolation makes symptoms of these things worse. So don't just assume it's a phase and that they will grow out of it. It's also important to know when to get professional help. If emotional distress, anxiety, or withdrawal become persistent or severe, if substance use is becoming the primary way of coping with difficult situations, or if there's any thoughts of self-harm, hopelessness, or if their behavior declines significantly, it's time to reach out to a professional. Here's more strategies for parents and caregivers. We want to have frequent, honest conversations with kids so that they feel comfortable talking about their feelings and what's going on in their lives. Encourage healthy social activities and try to be aware of behavior changes or mood changes in youth. Because young people learn so much about the world by watching the behavior of adults around them, it's so important for adults to model healthy behaviors and seeking out help when needed. If adolescents are in treatment for mental health or substance use, we want to have clear expectations of boundaries, what everyone's role is in treatment, and the goals of treatment. We want adults to know about Narcan, the opioid overdose reversal medication. Adults should know how to use it and keep it accessible at home. That'll be part of another one of the videos in this series. And finally, if there's potential for a co-occurring diagnosis in a young person, it's important that all health practitioners involved in their care know about it. This includes pediatricians, therapists, psychiatrists, dentists, etc. Just an example, if a young person is struggling with their mental health, that's something that an oral surgeon should know before prescribing them opioids after wisdom teeth surgery, for example. Keeping health professionals informed can allow everyone to make smart and healthy decisions. If you're looking for treatment for mental health and substance use, you should try to prioritize integrated care for adolescents. This means that they don't only just work on mental health or substance use, but are qualified to treat both and understand how those two issues affect one another. Family involvement leads to better outcomes for youth treatment. So if possible, treatment centers that allow family members to be involved in treatment should really be the priority. It's also important that a treatment center promotes mentors and recovery community, as well as continuing care after treatment and relapse prevention. It's a lot to think about, but effective care does exist, and there are organizations that can help you find it. Finally, what does effective care for co-occurring disorders look like? There are multiple types of care that are proven to successfully treat co-occurring disorders. Those include motivational enhancement therapy, cognitive behavioral therapy, or CBT, and contingency management if needed. For the family, strategies such as CRAFT, community reinforcement and family training, and invitation to change can help. It's also important to prioritize self-care for family members. And outside of formal treatment, we want young people to have activities that are fun and challenging, that don't have anything to do with substances, as well as practice with coping skills and problem solving. So to close us out, I want to share some resources that you might find helpful around this intersection of substance use and mental health. First, I want to mention our resources at Partnership to End Addiction. At drugfree.org, you can find many resources and articles on co-occurring disorders and healthy youth development. Under Family Resources on our website, you can get connected to our helpline, join support groups for parents and caregivers, sign up for text messaging programs to get resources and advice sent to your phone, take free parenting trainings, and more. YSS.org is your hub for local resources and local counseling and therapy services. YSS offers the evidence-based treatment shown to effectively treat co-occurring disorders for youth in Iowa. But YSS also has prevention, early intervention, and so many other programs for Iowa youth and families. Many of the tips that we shared today about things to keep in mind when seeking treatment for co-occurring disorders came from an organization called the Harris Project. They're a nonprofit devoted to the cause of co-occurring disorders in youth. You can visit theharrisproject.org for more information and resources. And finally, for more information about mental health in general, you can visit the National Alliance on Mental Illness at NAMI.org. From your friends at YSS and Partnership to End Addiction, thank you so much for watching this webinar.